Hi there. Welcome to The PrevenTable, the podcast giving you a seat at the table with conversations about the intersection of alcohol, drugs, and mental health in everyday lives. Take a seat and join us.
Welcome to The PrevenTable. I start every one of these off and people are probably like, is she disingenuous? Does she have to say this? Is there a script? And the answer is no, and no. We could not do any of this without Hubbard. I mean, they have these amazing radio stations, which I, of course, listen to every day. But also, they're so kind and they give us the space and the studio and it's just, I don't know. You walk in here to record and it's just like, oh, it's an extension of Prevent+Ed, and it's just really cool. So, of course, thanks to them for allowing us to do this each and every time. And I feel like y'all might get tired of hearing me say it, but I don't get tired of saying it. So there we are. With me today is I'm gonna call you a friend. You have saved me on lots of different occasions. You're one of these people who is a fellow executive director that kind of gets it. We share resources and commiserate and celebrate and all of the things. So with me today is President and CEO of Operation Food Search, one of the hallmark nonprofits in the St. Louis region, Kristin Wild. Welcome.
Thank you, Nicole. Great to be here.
Were you always into food?
Oh, I'd say maybe on a personal level, but
Yeah.
not on necessarily a professional level.
Yeah. So how did you get to OFS?
That's a great question. I feel like I had this very winding path.
Yeah.
So
Don't we
straight out
all?
of college, yes. I taught elementary school through the Teach for America program.
I was Teach for America.
No way. What city?
I was South Louisiana cohort, so we were not New Orleans. We were like 2 hours outside. I only lasted a year. Full disclosure, it was really hard.
Yeah.
But I stayed in education and I stayed in public health, but
I should have known that about you. I feel like there's something about Teach for America core members. There's just something.
Yeah, I would agree. Would agree. So where were you?
I was in Houston.
That's where I did my training.
What? I'm older than you are. What year?
2003?
Oh, yeah. I'm way older
Well,
than you.
I don't know.
I was 1991.
Okay. All right. Okay.
More than a decade earlier.
Okay. But I went to
Yes.
Houston to teach first graders ESL. And I'm like, what am I getting into? And then I was sent to Southern Louisiana. I was teaching sixth grade self-contained. So
A little different.
when I was in Houston, learning to teach, I was like, what have I gotten myself into? But so you were are you from Texas?
No,
Or are you?
I'm from Michigan.
Okay.
It was just a city that it was appealing.
Right.
I wanted to,
Because you got to
could go urban
choose
or
back
rural.
then, right? Yeah, okay.
So I wanted urban, and that was just one of
Houston's urban.
Yes.
And at that point in time in the 90s, I mean, it was really starting to explode, right? With a lot of Spanish speakers. It was.
Exactly. Yeah.
Whoa. So how long did you stay in Teach for America?
Well, technically 1 year in that placement. However, sort of long story, but I got engaged to somebody who was living in Nashville.
Okay.
And so I called Teach for America. I said, I am fully committed to this program.
Yeah.
I know it's a 2-year program. I want to continue teaching in inner city schools. So they allowed me to continue as a core member, even though they didn't have placements in Nashville.
Oh, interesting.
So then I went and I taught 2 years in Nashville after my year in
elementary.
Houston. Yes.
What
Yes.
what grades?
So I taught second grade in Houston and then fourth grade in Nashville.
Whoa. Cool. Okay.
Yes, yes.
All right.
And then I moved to Missouri, and they're like, we don't even have Teach for America here.
Yeah.
They did later on,
Correct.
2 years later, but
not
they
at that
didn't have
time.
it. So they said, oh, you're going to have to go back to school and get all these credit hours and student teach. I'm like, I've been a full-time
Teacher for 3 years.
Right. So at that point, I went to Sylvan Learning Center. I don't know if you're familiar
Cool.
with
Yes, I
Sylvan.
am. That's who helped me with, I'm going to say ACT prep.
Probably.
Yes. SAT or something. Yeah.
Yes. So it was a great transition because I wanted to stay in education.
Sure.
And they hired me as the director of education. I needed to be certified someplace, but not necessarily Missouri. I ended up getting Texas certification that was recognized in Tennessee.
Sure,
so
reciprocity and blah, 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 all the things.
So I was able to, stay in the field, but not as a classroom teacher. But that was a great experience. And then I went on I was the director of education, then the director, and then along with 2 others, I started a new center. So I was part owner of another center in Bethalto, Illinois. So it was great to see that from the ground up.
Yeah.
So it was a wonderful experience.
So then when did you get into nonprofit?
So I actually spent over a decade as a stay-at-home mom.
Okay, love this. The hardest job in the entire friggin' world.
Exactly, yes. And then after that, then I went to Autism Speaks.
Yes.
And then the Ladue Education Foundation and Alumni Association, which was a nonprofit affiliated with the Ladue School District.
Yes, that helps raise money for kiddos who need extra supports and things like that. Mm-hmm.
Yes. And then
because some people don't know that. Some people are like, oh, well, it's public school, so why would they need to raise money? Well, there's things that families need that, yes, they're getting free education, but
they're not getting a
field trips are
instrument.
not free. Musical instruments, school uniform, or sport uniforms. Like those things aren't free.
Right.
Those things cost.
Exactly. And I think a lot of people have the impression, A, that, tax dollars cover everything. And B, in a school district like Ladue, there's not going to be high need. Well, there is need in every single district.
Correct.
I mean, I think our percent of free and reduced lunch kids was about 11%.
Which is smaller than other places, but not zero.
Exactly. Yes.
Right.
Yes.
So, and then you went from there, from Ladue Foundation, then you went to
Operation Food Search.
In the executive director role?
Yes.
Holy smokes.
Yes.
And you took over for a long time executive director, right?
Sunny Schaefer. She'd been there for 22 years. Amazing.
Yes.
And
a legend.
This day, yes. She was in town this summer from Scottsdale, Arizona. She came to OFS to see the progress of our building renovation. We had dinner, and it was just great to see her. And every now and then I'll reach out and be like, Sunny, how did you handle this? Or tell me about this partnership that used to be, in the history books, but we're trying to rejuvenate it. So she's a great resource.
I told you this because I feel you came in during COVID?
Before. January of 2019. So
okay.
A year under my belt.
Okay.
Yes.
And I think I told you this, but I was on the Young Professionals Board of Operation Food Search.
Oh, yes.
So I had a very good friend who I just had dinner with 2 nights ago. Very good friend who was a dietitian, and she was working at OFS. And this is when you all were doing like bowls, like a bowl event with like pottery and stuff like that.
Before my time.
Yeah.
Yes.
And so that was my first foray into boards and all of that. And then she was also teaching some nutrition classes, healthy eating classes, things like that. And then she left, but then another friend of mine stayed on, Mariella. Did you know Mariella?
We didn't overlap.
Okay.
I've heard her name.
Yes. Awesome. Which is amazing. And so she was also kind of nutrition, healthy eating, things like that. And so I have loved you all and supported you all from lots of different avenues. Also, I was a big sister through Big Brothers Big Sisters for a long time. I was with my little for 8 years.
Wow.
And she received a lot of your services, in particular the backpack program. So this would be the time where, for folks who don't know, we probably need to talk about what Operation Food Search is. Okay. So you're a food bank, right?
We are. We're a food bank, but so much more. Yes.
Okay.
Yes.
Talk to me about what OFS is.
Yes. So we actually like to call ourselves, we are a food bank. We do food bank activities, but we call ourselves a hunger relief organization because it's broader. So we were founded initially back, really technically 1979 was when we got started, but 1981 we were incorporated as Operation Food Search.
That's a great year. That was the year I was born.
See, I told you you were younger than me.
Yes.
So it actually started, there was a former priest who approached Roger Dierberg in the office above the store, and he approached Roger and said, hey, what are you doing with all that food that you can't sell if you've have an overabundance or it's getting close to the expiration date. And at the time, the food was going to farmers to feed animals. And so this innovative individual said, how about if you donate it to us so that we can feed people?
Now, in the 80s, was this a pretty innovative concept, not just for St. Louis, but I mean, I'm trying to think of what the landscape would have been like really early 80s, hunger relief. I know Farm Aid was a thing, but
It was really just getting started.
Okay.
I mean, there are some food banks that I'm familiar with who've maybe been around for 50 years, so a few years longer than we have, but across the country. But that was sort of late 70s, early 80s was when food banks started to be erected.
Got it.
So we started with that, and that's really, we consider ourselves as having 3 pillars, and one of them is meet the immediate need, which is where the food bank activities come into play. So that through the food banking, we are getting a lot of food donations, purchasing some food, but the bulk of the food that we donate through our food banking activities is donated. So
through food drives, through different collections, through places giving you things they're not using, not expired product, right?
Right.
And not just, no offense to ramen noodles, but we need some nutrient-dense foods that people are donating.
Yes. So Schnucks is our top donor. They donate about half of the food that we get. We usually, in donations, get between like $25 to $30 million worth of food every year. Schnucks donates about half of that. Wow. But we get wonderful donations from Dierberg's, from Straub's. We work with Busch Stadium, with St. Louis City Soccer Stadium. Cool. With entities that are like Volpe Food and places that are not necessarily retail facing, but are in the food manufacturing distribution business. So we get all these donations, and then from individuals hosting food drives for us. We have our own food drive actually that took place in August called Shop Out Hunger. It's an annual event. This was our 14th year where we have volunteers outside of Schnucks, Dierberg's, and Straub stores with most needed items lists. Shoppers can go in, throw a few extra non-perishable items in their carts, and then leave those with the volunteers. So that's a great food drive.
Awesome.
And then the Boy Scout drive.
Right. So I was just going to ask. So the Boy Scouts is like in November, right? Scouting for food.
Exactly.
Okay.
So I think November 16th is when the Boy Scouts go around and leave bags at resident stores, and then the following Saturday and the 23rd they pick up the donations, and then we work with a couple of the firehouses. The St. Louis Area Food Bank also gets a lot of that food, and then we get some of it as well.
So Meredith has been on the podcast before, and we talked a little bit about like broad strokes, like this idea of like competition, right? And it's like, okay, there's plenty of people that need food, right? And food is a basic need that so many people don't have nutrient-dense food that helps fuel them. And it, like, you're here benefiting, on behalf of Operation Food Search, but like, you're also here to spread the message that there is food apartheid, that there is like real food insecurity, and you're doing that with Food Bank, with, all of these other places, local peace pantries, like in community. Like there's more than enough work to go around, right?
Yes, absolutely. And we collaborate. It would be great if neither our organization, Operation Food Search, and St. Louis Area Food Bank, if both of us would go out of business.
Oh my gosh, I would love to retire, but like, guess what? Like, unfortunately, we're not ending substance use disorders anytime soon.
Right.
There's more than enough work to go around.
Absolutely. Yes.
Yeah, so lots of partnerships.
Well, yes, we are built on partnerships. We partner with the food bank. We partner with a lot of smaller organizations that are really the frontline organizations, these food pantries that may be in the basement of a church, or they might be larger organizations like Circle of Concern, Harvey Kornblum.
Yeah.
So we distribute the food that gets donated to us. We then distribute to, it's about 180 partners through our agency network that they either come to Operation Food Search and they pick up food, or we assign them to a particular Schnucks store where they will go and pick up, but sort of as a representative of Operation Food Search, but they will take it back to their own agency to distribute to community members who need food.
So you mentioned the 3 pillars, and one is immediate need.
Yes.
Could you touch on the other 2?
Sure. And actually related to the immediate need, in addition to this agency distribution, that's where our child nutrition programs fall also. So Operation Backpack that you mentioned earlier.
Could you talk about that?
Sure. Yes. That program has been around, I believe, since 2006. and it provides food in, I think it's about 352 schools throughout the region, provides kids food over the weekends. So it usually includes about 4 meals to help kids get through the weekend. On occasion, we'll do a family meal kit. So instead of just being geared for that child, the food is geared for the whole family. And it helps a lot of kids who are on free and reduced meals and getting breakfast and lunch at school don't have adequate nutritious food over the weekend. So this is designed to help them get through the weekend so they can go back to school on Monday feeling charged and ready to go.
And the backpacks are not like, they're not labeled like, hey, you don't have enough food, here's some food, right? Like it's like very discreet.
Yes. So we provide backpacks to the schools. Not all of them want them, but a lot of the schools will take these backpacks that are just plain. There's no design on them. There's no Operation Food Search label on it. And then we pack the food. We do buy all that food because we want to control it, and we want to make sure it's great nutrition for kids and easy for kids to prepare themselves if they need to. So that gets put into bags that then get sent to the schools, and then the schools put those bags into the backpacks. And the backpacks come back, they get refilled, and go home the next week.
Correct.
So that's
it's
just a great resource.
Beautiful program, and it was the highlight of my little sister's week when she would get it. And I will say that, not having food is like something that you don't really talk about, right? And you don't, and it's not always the people, quote unquote, that you think don't have food, right? And I know you all saw the need surge during COVID. I know economic times of uncertainty and recessions and whatever are like places like that. Those are higher demand for you, but it's not something. Like, this is where there's so much overlap, I think, between our two organizations, is there's so much stigma and prejudice and ignorance, quite frankly, around, like, what people don't have, what they need, what it means to ask for help. My little sister, and this was, about 10 years ago, and I will never forget it. Like, she would get the backpack, during the summer. She was always a little curious about what that was going to mean and, all of that. And the one day, because we are, as littles and bigs, we were supposed to hang out like every month at least. And at this point, she was maybe 10. And I said, what do you want to do today? And she goes, I would like to go to Aldi. And I said, okay.
Not the zoo,
nope.
Or the park.
Nope.
Go to Aldi.
And I said, what do you want to do at Aldi? And she goes, I know that normally we'll go and we'll spend money on me and we'll go out to dinner or, go somewhere fun. She's like, but I want to go to Aldi and I would like you to take the money that you would spend on me and could we buy some groceries? And I'm like trying to fix my face, right? I'm trying not to lose it.
Right.
Right, exactly. And I said, this is a 10-year-old, right? And this is no shame on her mom. Her mom was doing the best she knew how to do. She had older siblings that were trying to work and whatever, but times were tough. And she said to me, I said, okay. I said, let's do that. How could you say no, right? So I figured I'd use this as a time to kind of talk about budgeting and talk about money and whatever. Dude, I didn't even have to. She was getting dried beans. She was getting noodles,
she was shopping on a budget.
Exactly. Not mac and cheese. She's getting plain noodles that she knew she's looking at ground beef. She was like, could I get some meat? I'm like, of course, of course. And I was like, well, let's pick out a snack. Wouldn't you know it, she goes and she picks out fruit.
Good for her.
Right?
Yes.
But she knew these are things she wasn't getting. I mean, she lived near some corner stores. She could very easily go in and get a bag of chips or something. That was not what her body was craving. That's not what she knew was going to go the furthest. And I was really worried when we got home. I was really worried how her mom was going to be, right? Because I was like, this is what she asked to do today. And the mom just like broke down. Like just broke down because like she knew that her kids knew the struggle.
Mm-hmm.
But
Mm-hmm.
and she wasn't she was sad and probably a little embarrassed, but she was also so incredibly freaking grateful,
Mm-hmm.
you know? So then I stayed and we made a meal together.
Oh,
And it was just, it was beautiful. And again, it's like something that like people don't talk about, you know? Like they don't talk about when their cupboards are bare.
Mm-hmm.
Or when they do ask for help. Sorry, I'm on like a little bit of a soapbox, but like on Facebook, you've got these buy nothing groups. Have you seen these?
Buy nothing groups?
Buy nothing.
No.
It's buy nothing. It's like gifts and wishes. You can go on. I'm part of one in St. Louis. I'm part of one in Birmingham. You can go on and you can be like, hey, I am looking for a new, like a mattress. I'm moving. I need a mattress. Does anyone have one that they're not using? Sure. Here you go. Here I have one. And it's awesome. People are usually very friendly.
Mm-hmm.
Until you have somebody that reaches out and says, hey, I don't get paid for another week. I have 3 kids. Does anybody have any food? There are some nice comments, and there are some people saying like, hey, yeah, I've got some, you know, a couple of things. Like if you can pick them up, be happy to let you have them. But the amount of comments that are so snarky is like, come on.
Wow.
Come on. And I think it's this thing that we don't talk about.
Right.
Which I'm sure is related to some of your other pillars.
Yes. And in fact,
sorry for my soapbox,
No,
but
no,
clearly
no.
this is a thing that I'm very passionate about.
I love it.
So,
yes. And that I appreciate your sharing the story about your little. So there is definitely an impression amongst some that people who rely on safety net programs are just getting a free ride. They're just sitting around, not working, and waiting for government handouts. And the reality is 2/3 of people who are on SNAP, otherwise known as food stamps, now called SNAP, Supplemental Nutrition Assistance Program, 2/3 are children, the elderly, and disabled.
Can you say that again?
Yes. 2/3 of our country's SNAP recipients are children, the elderly, and the disabled. And
these are not people who could get jobs, who just are choosing not to, and instead they're watching Judge Judy all day. That's not what this is.
Right.
Yeah.
And the majority of households that are recipients of SNAP have at least one working adult. And it's not a matter of they're sitting around watching Judge Judy. It's a matter of the wages in our country, the difficulty, the high cost of food, of rent or housing, of prescriptions, of utilities. It's very difficult for a lot of people to make ends meet.
Lack of transportation
Yes.
to get to places that are providing food, which leads us to this notion of food deserts, which I now have heard really the more appropriate term is food apartheid, because this is done intentionally, right? There are certain areas where you can throw a rock and hit 14 grocery stores and specialty stores and all the things. And then there are places where good luck finding some protein or some produce that isn't gross looking.
Exactly. And that's one goal of our Metro Market program.
Yes,
which
talk to me
we're
about
still on the first pillar, because this is still
I
on our
know.
first pillar,
Sorry.
No. But so the Metro Market program goes to areas of where there is food apartheid, food deserts, and basically is like a mobile farmer's truck.
Yes.
Farmer's market.
You're bringing the food to the people
Yes.
who need it.
Yes. So we currently have 2 vehicles. We've got one that is a retired Metro bus, which is on its last legs. We did have to put, I think it was like $10,000 into new air conditioning. This every summer, it has over 1 million miles on it, and typically has some maintenance issues. So we bought a new farmer's truck. that is supplementing the bus. And actually, we have a second farmer's truck that's due to arrive in October. So we will be retiring our bus next year.
Very
We're actually
cool.
looking into where it could, maybe go to the Museum of Transportation.
Oh, I love that. Cool.
Yes. So, but anyway, these mobile farmers markets go to areas where there's not a lot of access to nutrient-rich, healthy produce. Produce is a our big item. We also sell a lot of frozen meat, oxtails, very popular. We sell locally produced honey, locally made coffee. Our goal really is to sort of support the whole food system, local food system. So the vast majority of what is sold is purchased, often by BIPOC farmers. So we are trying to help those farmers who might not have a large enough farm where they're able to sell to a major grocery store chain. They are producing for us or
it's the
entities.
Whole ecosystem.
Yes. In fact, we're working on budgeting right now, and we have a new budget called Community Food Systems. We have a manager of Community Food Systems, and that's a big focus of hers, is to help build up these farmers. We provide grant funding to them. We have arrangements. Well, we actually glean with a few farms, but we have like one farm in particular, Three Rivers Community Farm.
Yes.
They actually plant specifically for Operation Food Search. So, we give them business, but
Can
then
I
they
work
also
for
allow
you?
us. Come move back to St. Louis.
Right. I just
Nicole.
want to work with you. I just love what you do. That's awesome.
Thank you,
That
thank
is
you,
so
thank you.
great.
Well, it takes a lot of folks.
A lot of people.
Yes. So that is part of our Meet the Immediate Need pillar is also, and then we have a couple other child nutrition programs, summer meals program, after school meals program, again, to supplement what kids are getting during the school day, during the school year. And then, so our second pillar is build nutrition IQ. So the people you referenced earlier were probably involved in that pillar, which is really to teach people how to shop, how to plan a meal on a budget, how to cook, all about nutrition, so that we can provide people the resources that they need once they have their food in hand, what to do with it.
Well, so, speaking of produce, so when I used to work at a public health department, and we would do a lot with nutrition in Jefferson County, and we worked with one of the local Peace Pantry, I think, down there.
They're one of our partners. Yes.
And I will never forget, and we were giving flu shots at the Peace Pantry because it was, kind of a one-stop shopping. And this was in the early 2000s. And we were doing some education around substances. And one day they got an amazing, beautiful haul of artichokes. Now, I love to cook. I love watching Food Network. I love chefs and whatever. Artichokes freak me out. I'm intimidated by them. And so we're watching these people in real time, like pass by these beautiful artichokes because they don't know how to prepare them.
Right.
I don't know how to prepare them. I couldn't even give them tips and tricks. But then, but you all had like recipe cards to like show people what to do with the artichoke and like what,
Yes.
It's beautiful.
Yes. Yeah. So it's because we'll get donations of things like artichokes or eggplants.
Yeah, right.
Yes, people just don't know what to do with them. So, yes, we provide the food, the recipes. We do food demonstrations.
And your amazing, beautiful facility, you do some demonstrations.
Well, wait till you see our new teaching kitchen.
Tell me more. Tell me more. Okay.
So we have our demonstration kitchen, which we kept, and that will continue to be utilized. But now we have a teaching kitchen that will roll out. We're finishing our renovation. Well, it'll be ready to go in late September.
Okay.
So we have teaching areas for the instructors at the front of the room, and then we have 8 different stations where there can be 3 to 4 people at each one, where they can watch what's being done at the front of the classroom. And we've got TV screens, so they don't have a great vantage point. They'll be able to watch what's going on. So in addition to having the demonstration kitchen, which is great, showing people are going to actually be getting their hands dirty and, doing the cooking themselves.
Okay, so you probably have already thought of this, but let me just ask you if this is in your brain. So, you can go to Dierberg's and do cooking classes and Kitchen Conservatory, all super great. If like I'm having a birthday and I want to do a cookie, could I rent out your facility and all proceeds would go to OFS?
Yes. Yes. We haven't worked on all the logistics, but
Understood.
yes, we would love to open
My
it up. My
birthday's not until January, so that gives you
We'll
some
figure
time.
it out by then.
Okay,
Yes.
cool. Awesome.
Yes, and we, love to have corporate groups come
Yes.
in. And, it is, we have a program called Nourishing Healthy Starts, which is for food insecure pregnant women. And part of their program is this nutrition and learning how to cook element. So we have done demonstrations in the past, but it's been limited as to how much hands-on it can be. Now with this teaching kitchen, the participants in our program will be able to cook right alongside our nutrition educator. Yes.
That's awesome.
Yes. So that's
awesome.
our, this is the second pillar.
Yes.
Building Nutrition IQ. We've got lots of videos on our website at operationfoodsearch.org that anybody can go and get these yummy recipes with, unique ways to put ingredients together. And,
I love it.
Like black bean brownies and, smoothies.
Oh,
with
that's
all
where
sorts of,
she got the... My friend Erin, the one I was talking about, who used to work she made some black bean brownies one time, and I'm like, I don't like these.
Did you try them, though?
I did try them. I didn't love them. But I did try them, and they grew on me. That's what I will say.
All right.
And she's not a person that's trying to sneak in ingredients, which I appreciate. I don't like that.
She was just upfront.
She was
Told
just
you there were
upfront.
black beans in there.
She also made this like dip that had like chickpeas, and it was like it's supposed to taste like raw cookie dough. Now that is real good.
Was it sweet?
Yeah.
Oh.
But you wouldn't know it. But it like gives the color and the consistency.
Okay.
I'll have to share it with you. It's very
Yes,
good. Anyway,
yes.
Sorry.
Yeah, so recipes, we do food demonstrations, we'll go into agencies and provide, again, assistance there.
Mm-hmm.
And so then our third pillar is champion change.
Yep.
So in that pillar, that's where we concentrate our policy and advocacy work. And we have, in the past, really concentrated on Missouri policy, but our reach is we're in 25 counties in between Missouri and Illinois. So now we're actually, this past year, we were starting to ramp up policy work in the state of Illinois as well. And just talking about the trips we're going to be making to both Jeff City and Springfield, Illinois, because, both states need our involvement. So we are helping to advocate for policies that help families put food on the table.
You have done a lot of work with one of my very good friends, Kelly McGowan.
Yes.
And we've talked with her too, speaking of a champion for change, right, with Transform 314 about, and again, here's like overlap, right, is, really looking at how the system is built and designed to keep certain things happening and to keep certain things from happening, right? And we talk a lot with Kelly about alcohol outlet density. And it's no accident that there is lack of access to healthcare, to food, to whatever in certain communities, but an overwhelming amount of access to harmful substances like alcohol, vaping products, things like that. And so like thinking about how we can beef up the infrastructure in those communities while also putting in policies that make sense, right? And make sure that kiddos are getting food at schools and
Yes.
we're not having to worry about it every couple of years, like just making sure we have access. Right.
Exactly.
So do you have somebody on staff that does that, or is that you?
We do.
Cool.
We have we just changed the department name to Government and Community Relations.
I love that.
So we have on that team currently, we've got 3 individuals, 2 of whom are focused on the policy work. One of them is doing more of the community food systems work that I mentioned earlier with farmers.
Love that.
So yes, we definitely, we have in the past had a lobbyist. We have sort of gone back and forth about whether or not, our own staff people have done a great job doing testimony at the Capitol. So,
well, and sometimes it's almost like you need that to kind of get you kick-started and get you like at the right tables. And then if you have in-house staff that can pick up that ball, like then why not?
Right.
So, and maybe sometimes you need to pull them in when there's something really big, like a farm bill being discussed or something like that. But
Yes.
Yeah.
Yes.
So you have like events all the time.
We do. I'd say we have a couple of signature events. But then we have a lot of campaigns.
Like, okay.
Where we're partnering.
Like I would call them third-party fundraisers, but it's like a company that like wants to do something on your behalf, right?
Right. Like one that we're in the midst of now, this is our third annual year, is called Tackle Hunger. So we work with Neighbors Credit Union.
Love it.
And KSDK. And basically 2 schools get selected for each Friday. It's the Friday night football game where there is a rivalry.
Get it.
Yes.
Got it.
And the week preceding that Friday night football game, each school competes to bring in more food donations.
Okay.
And then it gets announced at the football
healthy competition.
The football game, or it might be the Monday after, where it gets announced which team won the Tackle Hunger competition.
Amazing.
It's wonderful. We've had such incredible support, and there was one kid last year who he just was on this campaign to build up this right in his own community. It was in Illinois, and he just like that one school brought in like 15,000 pounds of food. He was putting flyers everywhere, and his school was the winner that year and that week. So it's just a lot of fun to get people. Not only is it the food that's coming in, but it's building awareness. I mean, these are high school students,
correct,
who are learning, there are kids who don't have enough food at home.
Well, let me just tell, okay, so 2 things you said, and then I want to go back to an event that you have coming up. But so 2 things you said that I'm like, ding, 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 ding. So at Prevent+Ed, we're in schools, 70,000 kiddos we're serving. A lot of our staff are educators who had seen the power of the backpack program, knew that their kiddos were struggling, with hunger. They're keeping like packs of crackers and granola bars in their desks because their kids were hungry. But then there's also like people who don't know like what that looks like. So during COVID, when we couldn't celebrate for the holidays, we did a drive-through parking lot party. And people drove through our parking lot, quite literally, and they got like a swag bag of Prevent+Ed merch. They got some food. We had like a coffee truck or whatever. And then people donated food. Because at that time, just to go back in history for people, like there were very long lines of people needing food, especially as people were losing jobs and were furloughed and whatever. And the cool thing when we loaded up the truck and brought all the donations is that you weigh it in real time, and so that we were able to go back and say, like, here's what difference we made.
Yes.
But then also right after that, I think it was after that, once, we came to your facility as a staff. We got a tour. We heard about what you do. We got a chance to kind of see you all in action. And I think for folks, like, I think it started clicking. Like, number one, like how it's every nonprofit has to work together. And people who are using our services are probably using yours and vice versa, and a million other nonprofits that are, hidden or in plain sight. And it's just like it's just like the synergy that's needed,
Yes.
But I love that you weigh it in real time. The person who is receiving the donations was like, thank you so much. And that's not why you do it, but it's still like.
Right. It's gratifying. And it's good to know what is the impact.
Correct.
So, we always will report out to organizations that conduct a food drive for us, or a volunteer group who comes in. We're able to say, okay, you packed X number of backpacks. That saved us X number of dollars that we weren't paying staff to pack those backpacks. That money can just go get turned around and put right back into our programs. So I think it's important for people to know that they are truly making an impact, whether it's their time, their money, the food they donate, because it really is.
Yeah. Before I let you go, tell me about Feast for Change.
Oh, yes. Feast for Change. That is a signature event of Operation Food Search. So that takes place on September 14th.
Okay.
It is our Farm to Fork event where we are serving a gourmet meal that is all locally sourced. It's delicious. This is our 4th
I'm
annual.
like salivating. Okay.
Shouldn't be talking about this at lunchtime.
Yeah, right.
It's going to be held this year at the Moto Museum.
Love it.
Near the Fox Theater. And we always have a little farmer's market. So during the cocktail hour when people are typically, drinking and eating, they will be doing that. But they also will have an opportunity to shop our little farmer's market. We'll have, we typically have, locally grown apples. And
I was going to say September.
Made,
Whoa, that's a lot. That's a good time for produce here locally.
Yes. So, and we have non-food items, so candles and soaps and things like that. So it's a lot of fun. It's just sort of a unique twist on the typical gala that people attend.
For sure.
So that's just always really well received. And then we have a wonderful dinner, and then we don't have a silent auction. We have a live auction.
Awesome.
Opportunity for people to fund the future with a paddle raise. So it's a fundraiser, but it's definitely a friend raiser also. And our goal again is to raise awareness. We have our Champion for Change Award. We're going to be recognizing 2 longtime volunteers, Denise and Craig Evans. And also this year we're recognizing a company. This year we're recognizing Brian Cave, BCLP, they go by now, Brian Cave, Leighton Paisner. We have a magnificent board chair from Brian Cave. And
our former board chair was Brian Cave.
Yes, wonderful law firm. They've done so much for us.
Great.
And Aaron Brooks, who's our board chair, is just a wonderful champion for our cause. So it's a very well-deserved honor for both Denise and Craig as well as Brian Cave.
And tickets are still available. They go to the website if they want to do that, right?
OperationFoodSearch.org. Yes.
Did we miss anything? I feel like we could talk for a long time.
I know. I mean, I feel like with the 3rd pillar, the Champion Change, that's where in addition to the policy and advocacy work, that's where our Food is Medicine programs are housed under that umbrella.
Okay, before you leave, please talk to us. Give me 2 minutes on Food is Medicine.
Yes.
Because yes, it is, y'all. Yes, it is.
It is. So many individuals with chronic health conditions.
Which again is a tie-in to Prevent+Ed with pain management and all the things. Go.
Exactly. Yes. So we want to ensure that people with those chronic health conditions, in addition to pregnant individuals, which I wouldn't say is a health condition, but it is a condition when nutrition is especially important.
For sure.
Yes. So our one program called Nourishing Healthy Starts is focused on food insecure pregnant individuals to provide them food resources, the nutrition education, as well as community resources. So they have a maternal health advocate assigned to them to help them enroll in safety net programs, connect them with other resources in the community. We even have like a cash assistance fund if someone needs help with a utility bill 1 month. So we basically are trying to ensure that the pregnancy is as smooth as possible. The baby is born full term, healthy, and the mother has reduced stress in her life. And this goes beyond the time they're enrolled in our program because they're learning, more these cooking skills that we're providing and nutrition education. And we have found that the postpartum depression has gone down amongst our participants. The full family is fed. We're not just feeding the mom because we know there are probably other kids in the majority of our participants' families. So we want to ensure that the whole family is getting fed because we know that mom will always give to her children.
And comorbidity and comortality is like really big. Like health outcomes for pregnant moms are not great in Missouri and our nation where, you would not think that. But we've had lots of episodes here talking about how pregnant moms are at really increased risk for all kinds of things. And, clearly the more that we can support them with nutrients and meals and support and through all stages, so thank you for doing that.
Oh, you're welcome. Then we also have a program we're partnering with Greater Health Pharmacy where they are a fabulous organization located in the Del Mar Divine.
Love it.
They deliver prescriptions to individuals who need delivery, who don't have transportation.
Yes.
And along with the prescriptions, they are now delivering, a lot of it is produce, but produce bags as well as some non-perishable items as well. But food that we're providing through a grant from BJC.
Awesome.
And so people who have, a lot of the patients have diabetes and or hypertension.
Yeah.
They're receiving food along with their prescription. So, and we've done other programs where we've partnered with Mercy. We had it was called the Fresh Fork Market, where patients who again have diabetes and or hypertension came in to have access to this. Basically, it was a pantry right at the Mercy Clinic in Ferguson.
Love that.
We're able to pick up food, and then we also had our nutrition educators providing some education and courses. So it's programs like that where, we love to partner with the healthcare systems.
Yes.
And
places where people are already going.
Exactly.
So if we can save folks a stop, especially if transportation is an issue, or we can go to them, how do we partner? It's I don't know. I love what y'all do. I think it's so needed. Really, thank you for being on. Thank you for being one of the really the safety nets, the pillars of the region. I think you're feeding people that we know that you might not realize that are receiving your services, but they are. And I think what you do is really incredible.
Well,
so
thank you.
And you have a great team. So
Wonderful.
Thank you very much for being here.
Sure. Thank you. And thanks for all the good work that you have done for Prevent+Ed, and wish you were back in St. Louis full time.
I know. I'm splitting the time, but that's okay. I can still support amazing folks like you. If you liked what you heard, and I know you did, y'all, please consider rating, reviewing, and subscribing to The PrevenTable. Check out Feast for Change. Hit up Kristin. Their socials are great. Website is great. Tons of resources. Thank you for doing what you do.
Thank you, Nicole.
Till next time. Bye.
Bye.
Thanks for joining us at The PrevenTable, brought to you ad-free by Prevent+Ed. Prevent+Ed works to reduce or prevent the harms of alcohol and other drug use through education, intervention, and advocacy. Please visit their website at PreventEd.org. Like what you heard? Rate, review, and subscribe to stay up to date with what we are serving on The PrevenTable.